This webinar is about selecting your Payee NPI and how to get paid correctly. This is the overview for this webinar. The EHR Incentive Program provides opportunity for incentive payments for using your certified EHR technology. CMS allows the EPs to voluntarily reassign their incentive payments to another business-related entity. Group practices and clinics to which the EP reassigns payments are strongly advised to retain signed documentation from the participating EP. Such records are valuable in the event of an audit and/or possible future dispute over the payment. In order to reassign your payment to another entity, the EP must have a current active business relationship documented in the Provider One system. For the purposes of this program, this means that an eligible provider must be listed as a servicing provider in Provider One under the exact NPI selected in the Payee NPI section of the CMS registration. This relationship must be current at the time of attestation. This is what a business relationship looks like in Provider One. You will go into Provider One into your business domain and look for example Heather's Clinic. You will click on your NPI number and go look in the list for your servicing NPIs. Once you find your provider there and you see that the dates are accurate and then there is an NPI listed, you should be able to use that Payee NPI. If you receive an error during your attestation that informs you there's a problem with the billing relationship, it's most often caused by one of the following. The EP is not listed under the Payee NPI in Provider One as a servicing provider. The EP's relationship ended or expired before you attested with the state. The Provider One domain for the eligible provider or the Payee clinic is no longer active, or the Provider One domain for the eligible provider or Payee was created after the date the patient volume was calculated. Are your payments going to the correct address? If your payment is going to the same NPI that claims are paid to, it'll be included on your RA or payment. You can identify the incentive payment by the code 144 on your RA. If you don't get claims paid to the Payee NPI you're using, then payment follows the mailing address set up in Provider One under that NPI. Please keep in mind that tax liability will go to the tax ID set up under the Payee NPI in Provider One. The CMS site states that it will go to the address and tax ID entered in the CMS registration, but that is for Medicare payment only. Your payments will be sent according to the information on file in Provider One. Please let us know if you have any questions. The first tab in EMIP is called the Federal Information tab, and this is populated by the information you entered in your CMS registration. In order to change anything on this tab, you must do so in your CMS registration on their site. If you need help with your CMS registration, they have a helpful user guide on their site. There's a link for the site below, and if you go to page 11, it'll show you how to make those modifications. When you get into the CMS registration page, this is an example of what you'll see. Please see our resources for contact information and website information. There's information here for both us and for Department of Health as well as CMS.